Let me invite Dr. Krishna Kanhaiya, who is joining us from UK. Kanhaiya ji has done his MBBS and MS in General Surgery from India. He is FRCS from Edinburgh, DFFP from London, and MRCGP from London. He is a general practitioner partner in Waterfront Surrey, Birdley Hill, Dudley, and GPWSI in Dudley CCG, West Midlands, England, UK. Kanhaiya ji, may I request you to explain about how the medical system works in UK? Some input about NHS, the health system in UK. Unlike Germany, we have several systems here.
Sure.
So please, Kanhaiya ji.
Thank you very much, friend of Indian Diaspora Forum, and also Dr. Gautam Sagar ji. And it's a very vast topic to cover in a very short period, but I will try my level best to give some salient features of that. I'll just give you some background of that. This is founded on 5th of July 1948, so roughly 74 years ago. We're working here. And it is the publicly funded healthcare system, overseen by the Department of Health and funded through taxation rather than any health insurance, what you have in Germany. And we have 4 parts: NHS England, NHS Wales, NHS Scotland, and NHS Northern Ireland for whole UK. The structure difference can be there, but the delivery system is the same. And you will be surprised to know that this is the second largest healthcare system in the whole world, only second to Brazilian Sistema. And the Prime Minister of the UK, Winston Churchill, has said rightly that it gives all the provision to people from cradle to the grave. So this is the beauty of that. You born and you die, and the health NHS is taking care of your all the healthcare system. So coming to the system, it's a 2-care system here. One is the primary care system, which deals with the GP, dentist, and the pharmacist. And second is the secondary care system. This is for the planned hospital care, rehabilitation care, urgent and emergency care, and community health care. Now come to the point, who can access the healthcare system in the UK? All the UK resident, people from the European Economic Area, or maybe on the European health insurance card holder, national from the outside with the indefinite leave to remain in the UK. Any overseas people, if they get the indefinite leave to remain in the UK, get the same benefit. And healthcare costs in the UK, most of the services are free of charge. They don't pay any money for that. But charges for the dental treatment is there. Whether you are the NHS patient, whether you are the private patient, you have to pay money for that. And there are different banding system, band 1, band 2, and band 3, starting from the £23.80 and highest up to go up to £685. So, but the NHS people, they have to pay less money than the private patient. And also we have to pay for the prescription. So prescription cost has gone up to £9.35 for each item. Though there are some people, they get the free NHS prescription, and they are above the age of 60, below the age of 16. If somebody, they are in the age of 16 to 18 in the full-time education, or pregnant women, they get the free prescription, and up to the 12 months after the baby. And certain medical conditions, they also get the exemption, like diabetes or underactive thyroid, or some of the mental health, some of the other health conditions like that. Some economic group also get support, like income support group. They get the free prescription, income-based job seeker allowance, income-related employment and support allowance, and pension credit and the universal credit people, they get also the free prescription. And the charge is very high. So if somebody, they get the free prescription, they are very happy for that. Now, how to register in the UK? 90% people, they are registered with the GP. We call the GMS1 form. So it is for the family doctor service registration, where you need valid ID. So either your passport, either your driving license, and also proof of addresses. Mostly the utility will suffice it. So then they make a medical card. Private healthcare is very, very less than 10% of the people, because only rich people can afford it. So, but it's less than 10% of the people. And like the Germany, there are several, the health insurance system like 𝗵𝗲, 𝗵𝗲𝗶, 𝗃𝗏, Vitality Health, the 𝗃𝐸𝗃, 𝗊𝗶. And they give you the healthcare facility, and the benefit of that you can get very quick access to the healthcare and with better facilities. Now come to the NHS framework. So the doctors and specialists in the UK, mostly the primary care GP, they are the first point of contact, and then the other specific healthcare like the women healthcare system in UK. Gautam sir, can you share my?
I was also wondering that why we are not sharing it.
God, I forgot to tell you to share my slides. So.
Okay, give me a second. I will just share the screen.
So I mean the system it works very well. I mean already 74 years old in the system and very structured. So everything is written in black and white, and you come slightly higher than you go to the doctors and specialists in the UK.
So Kanhaiya, I have shared the presentation. So where shall we go now? In which slide?
Yeah, you go ahead. Go ahead. I am on the how to register in the UK.
Yeah.
Yeah, and then come back doctors and the specialists in the UK.
Yes.
Okay. So go slightly. Yeah. So the other is the women healthcare system, the UK. I mean it covers to the GP and also to the well women clinic, and mostly to the gynecology services, all free sexual health services, free contraception, maternity care is free from conception to the delivery, IVF treatment for women under 40 is free, but they have to meet certain criteria, like they don't be any smoker and other things like that. So these are the things they cover, and screening program. They have very wide spectrum screening program for cervical cancer or breast cancer. And abortion below the age of 24 is legal here. So if somebody have that, they can go to the GP, they refer to the family planning clinic or maybe in the hospital. Next slide, please. Children care. Children, I mean, they are the bodybuilder of the society, and they are taking very much care of the children, starting from the birth, and they have the free vaccination services there. They're starting from below the age of 1 year, so they start with the 8 weeks, then 12 weeks, then 16 weeks, and then from 1 year to 15 years, they have all the vaccines like hep-B, 𝗵𝗲, MMR, pneumo vaccine. And from 2 to 10 years, they get the flu vaccine every year. And between 3 years to 4 years, MMR second dose, and 4-in-1 preschool booster. Between 5 and 15 years, now they are getting the COVID vaccine, first and second dose. And 12 to 13 years, they have for the female, they are HPV vaccine to prevent from the cervical cancer. And 14 years is the 3-in-1 teenager booster and 𝗵𝗲 also there. Now come to the mental health. Mental health is a very big issue in the UK. I mean, not only in the UK, all over the world there. 1 in 4 people, they suffer from the mental illness. So that's why the NHS is covering very good for the mental health care. Starting from the psychological therapy, counseling services, drug and alcohol services, children mental health services. Below 16 years of the age, if they have any mental problem, they have been taken care of in the hospital rather than in the community. And eating disorder is also a very, very big issue there. So when we detect any eating disorder, we have to refer to the specialist to treat it. Next slide, please. Dentist. The dentist services are, I mean, you will be surprised to know that dental education is more preferred than the medical education because it's very, very paying. And even on the NHS or the private is always been paid. Though for the NHS services it is less payment, for the private it is the more payment. But free dental services are available. Less than 18 years of age, all free. In the 19 years of age, if somebody is a full-time education, it is free, and pregnant women and postpartum female is also free. But all cost has been taken by the government from the government to give to the dentist. And I just already mentioned before, the payment band is from band 1 for it's £23.80 for dental examination, diagnosis and advice. It also includes X-ray. If somebody needs X-ray, X-ray has to be done. Band 2 means band 1 plus additional treatment like filling, root canal treatment, extraction. And band 3 is the 282 pound. And it includes 1 and 2, the very complex treatment like crown fitting or denture or bridges. Next slide, please. Pharmacies is easily found everywhere. If you go to the town, all the town is high street, you can get it. Next door to the GP service, surgery. Independent pharmacies are always there, and a large retail store. You go to the supermarket like Boots, Tesco, Asda, they are all there. And some of the pharmacies are open 24 hours. You go to the large cities area there. Anybody can get any prescription throughout the 24 hours. Over-the-counter medicines are also available where the pharmacist they treat the patient for some minor problem, cough and cold, and some of the minor injury. They can treat it, and there is no any prescription needed. Prescriptions also only medicine is only issued by the doctors and some clinicians. Okay, can you go to the next slide, please? Yeah, normal pharmacy, I already mentioned the time period. Up to 6 p.m. every pharmacy is open. But between some of the pharmacy open till 10 o'clock or 11 o'clock, and from large city, all pharmacies open 24 hours. Come to the access to NH services from the visitor. This is very important. I wanted to highlight it. That if you are in the life-threatening condition, but the mentioned by Deepak also, that if somebody has MI or difficulty in breathing or stroke or any loss of consciousness, anaphylaxis, collapse, or exacerbation of DIB like COPD or asthma, they can ring 999. In place in Germany it is 112, but here it is 999. They will connect it, and ambulance services they reach within 5 to 10 minutes time, depending upon the situation. So that's very good service here. I mean, if you see ambulance on the street here, and the road is blocked, the road will completely empty for ambulance to pass through there. The second one, we call it the 111. It is 116 and 117 in Germany, and therefore the urgent advice, it is open 24 hours. Anybody can ring and get the advice, and they advise accordingly, whether to go to the pharmacy, whether to go to the GP surgery, whether to go to the minor injury clinic, or whether to go to the hospital in A&E. The other one is the walking center or minor injury unit or urgent treatment center. This is for some minor thing, and it could be either walked in by the patient, or maybe it will be advised by the 111 people to go there. A&E in the hospital is open 24 hours. So anybody can go to the hospital if they have to, but sometimes it is misused. They walk in there because in the night time because they get very easy treatment very early. But normally, if somebody has very dire emergency, A&E is the best place to go there. Local pharmacy, I already mentioned you that they can get the over-the-counter prescription, and also some pharmacies they give flu vaccine, other vaccine to slightly decrease the load to the GP. And of course, the last but not the least is the appointment with the GP, because they take the 90% of the brunt of the all admission and all health care. Next slide, please. GP services. This is the first point of contact for nearly all the NHS patients. And as I mentioned before, GMS1 form you have to complete with the ID and proof of address. And if somebody they are short visitor register, as a temporary patient between 1 day or 30 days, they can also go to GP services to get the treatment. It is free for the all European economic area, and somebody who is carrying the European health insurance card, they can also get the the free treatment. It applies fee for the overseas patient. If somebody they come, if they don't have the insurance, they don't have any facility to go to anywhere. If they come to GP surgery, GP can see as a temporary patient, but they charge for that. So next slide, please. Hospital service, it is free for people who are ordinary resident in the UK. Either children by birth or indefinite leave to remain in the UK under settlement scheme. Also visitor from EEA and EHIC. Also, some PRC, because the provisional replacement certificate. It is also the entitlement for the medically necessary healthcare. If you travel to Europe to here, who don't have the EHIC. EHIC has been replaced by the GHIC now, because the Global Health Insurance Card. And the other one, the S2 arrangement. S2 arrangement is also the people residing in the EEA or Switzerland. They can get the plant treatment healthcare system in any of the European country at the expense of their own home state. People from the Norwegian passport, they are also free. They get it. Some of the people from the other, European countries, they have to pay. People visiting more than 6 months of the time. This is for, especially for some overseas people. They come. They have to pay for the immigration health charges, and that is very high amount, £470 per year per person for the student. They have some concession, and for each of their dependents. But it is very high, £624 per year per person for everyone else. But people, they are visiting less than 6 months, they must get their health cover or health care through the personal insurance when they come to this country, because they have to pay 150% of the national, NHS rate. And GP referral is always required for any non-emergency hospital treatment. Even the private referral, most of the time they will ask for any referral letter from the GP to be seen by them. Next slide, please. These are the free services to everyone. Even they are a UK national or even they are overseas, they are all free to everybody. Any services are free, but when they are admitted in the hospital, for any, like somebody has MI or difficulty in breathing a stroke, then they have been charged for the admission, for the bed, and for the further treatment. Even the follow-up, if they go for the follow-up, they have to pay for that. It's a big money. I mean, I know some of my colleagues' friend, father, mother came and they have to pay roughly £3,000 in total for the admission. Family planning services is also free, but it doesn't include the abortion and infertility treatment. Treatment for the most infectious diseases, including the sexually transmitted disease, is also free. And if somebody they develop mental or physical illness, even by the torture, female genital mutilation is a very concern here, that if somebody they also get the free treatment, and domestic and sexual violence. And since 2020, the COVID treatment is also free for the all overseas visitor. But anybody living in the UK, even they don't have permission to live in the UK, they don't check the immigration check, and they can be treated as a free for the COVID-19. Next slide, please. There was one thing actually, Dr. Gautam asked me, that how to inform if you are sick. So can you come to the one slide before, Dr. Gautam? Afterward? Oh, don't worry. I think this slide is not there. So I just wanted to mention that if somebody they are sick and they can't go to work, they have to inform their employer as early as possible, because they have to make some alternative arrangement. And they can self-certify for 1 week time. They don't tell any doctors not to do that. What is called, we call it the 𝗵𝗲 here. But if somebody has more than 1 week of sickness or not going to work, then they need the medical certificate. But now it has slightly been eased, because recently it has been introduced that even nurses, occupational therapists, pharmacists, and physiotherapists can also certify and give 𝗵𝗲 to them. Come to the last few slides. The NHS system, this has been completely some revolution been done in February 2012. We developed the ICS, because the Integrated Care System. It is just to remodify the NHS for the better delivery and a better cohesion between all the working partners like NHS provider, CCG, local authority, voluntary sector partnership. And the other one is called the Sustainability and Transformation Panel Partnership. It introduced in 2016, where they divided into certain sectors. We have 44 new geographical footprints across the England that works in cohesion with the ICS. Next slide, please. These are the bodies, the governing body, because the ICS NHS body. This is the first part to deal with that, and the second part is to bring it together. And there are small sectors because the places. Places are several smaller planning footprints within the integrated care system to improve patient pathway and delivery mode, joint of care. And last slides again. And this is the neighborhood. The neighborhood is also consists of 30 to 50,000 people with several neighborhoods. and covering a small size of this one, and that is also for the better delivery and better healthcare. PCN has been introduced in 2020. This is a group of the local GP practices with other primary and community care organizations to join up health and care system in the neighborhood level. Next slide. Thanks for listening attentively to me. If you have any questions, you can ask. Thank you.
So if anyone has any question, feel free to ask.
I would like to ask a question.
Yes, please.
Yes, Dr. Kanhaiya, first of all, thank you very much for this enlightening overview of the NHS system. I would like to ask about how is the private sector working parallelly with the NHS? How does it work? Is there a connection between the NHS and private sector, or both work parallelly, independently, or how is it?
Not at all. The private sector works in the different way because they are the private one. And what I mentioned, that only 10% people, very rich people, they can only afford. And that is only to bypass the waiting time. If somebody, if they have been told that their knee replacement will be done in 1 year time, they go private. And the same consultant, they work privately to get it done. And now what they have done is that it could be done under NHS also. Some of the hospitals are listed for the private world. So they get referred to the hospital, they get the treatment very easily, and they get the better treatment and paid by the NHS. There's a certain amount for it, not as much what they are charging, but there are certain amount.
There's a middle way basically between one can go through the NHS in a little upgraded way with little expedited.
Some people, they can go through the NHS when they know it. Because sometimes the private, the insurance people, they'll tell them patient that you go to GP and get referred to the some of the hospital where the NHS work can be done, under private cover. So people and the patient, they are getting more clever and clever to get the things there. But of course, the private treatment is always better and always, very easy to approach.
Okay.
I hope I have answered your question.
Yes, certainly you have answered him, because my question was that I know that both systems work, but how is that this middle ground that happens? That was not clear to me. Thank you very much.
Middle ground is bridging between the two things by the either patient, intelligent patient, and also the private, the private insurance. They tell them to advise what to do that.
Yes.
Poor people, they can't afford. So, if some consultation they charge £150. So £150 is a big money for somebody to go for the private consultation.
Yes. All right. Thank you very much.
Thank you very much. Thank you very much, Kanhaiya ji.
One is sometimes it takes a very long time to get an appointment with a specialist, be it an ortho or a rheumatologist. Who can help me, and what is a time span that I'm looking for if I feel it's urgent, but I'm not so sick to go to a hospital? Who can help me, and what time span should I really think of to get an appointment?
Thank you, Rashmi ji. I think it's very difficult to get early appointment in the GP surgery and also in the hospital because the long waiting time, especially during the COVID and after COVID, still there is the backlog. But sometimes what people they do, if they have ongoing problem, they come with the acute onset in some chronic illness, they go to hospital in A&E. Been seen by the A&E people there, and they contact the specialist on the same day. So they could be seen a bit early, but the normal chronic illness patient, it's always a waiting time. There's one system here we call the 2 weeks referral. 2 weeks referral if you are suspecting any cancer. So if you refer straight away to the 2 week referral to the specialist, they have been seen within 2 weeks time. I noted in my more experience that they had been seen within 1 week time. So if you're suspecting any cancer in skin or they have certain, a form for that. So you have to send it, urgently to the hospital, and they see within 2 weeks time. That is one of the good points here about any cancer patient or suspected cancer patient, they could be seen very early.
Thank you very much, Kanhaiya.
Other than they have to wait very long. Sometimes I tell you, some of the patients, elderly patients, they are waiting for the hip replacement, they are waiting for the knee replacement, they die before they get the appointment. Some of them, they are very clever. They go to India for some holiday and they have package deal there. So they have their both knee replaced and they come back from there. But here is slightly, not very good for some of the operations and some of the treatment here.
Thank you very much, Kanhaiya. So maybe Deepak, can you say a few words from the German side? I think it is similar.
Yes, it is similar, but in what I hear now, I would say here it's little better. Little better in the sense that people, I mean, everything is prioritized, like the things which has to be prioritized is prioritized naturally. Things which can wait, the rheumatology, for example, here also takes not less than 6 months to get an appointment. But here is a system where one can get within 24 hours a 𝗲𝗏 term. 𝗲𝗏 is basically a specialist who has cleared his residency and is working as a specialist. So one can get a 𝗲𝗏 term, a 𝗲𝗏 appointment within 24 hours. Through an online system, but only thing is that it will be far away. It will be little in a different city, for example. So that system is there. That in that way, I find in German system it is better than that in this aspect. And also about surgeries, there is waiting time, but not so long. And yeah, so, I mean, few weeks waiting time, couple of months is there certainly. And emergencies, as it is similar in both countries, emergencies is treated on emergency basis. So yes, that is what I would say.